International Continence Society has decided to promote awareness about the incontinence and related issues by promoting World Continence Week. This World Continence Week falls this year on 17th June to 23rd June. The idea is to make people aware about the urinary incontinence or urinary bladder related symptoms, and people should be aware. So it is using print media, social media, and the use of expertise and their knowledge to spread to the general public. What is incontinence? Incontinence is poor control or undesirable passage of urine through a normal passage. Like our urinary bladder has about 400 to 500 ml holding capacity. So whenever we have a desire to pass urine, the urinary bladder sends signals to our brain. We usually find out a suitable place to empty the bladder, and till we find that place, the bladder pressure is maintained through a normal system of controlling mechanisms, and we generally do not pass urine without our knowledge. Incontinence is that we have a poor control on alter this mechanism of holding the urine. Like suddenly you get an urge or a sensation of passing urine which cannot be postponed, even though we do not have any desirable place to discharge the urine. That sensation is such a strong that even if you try to control, few drops may leak, or sometimes even with the coughing or sneezing, few drops of urine may leak. That is known as stress urinary incontinence. And there is an incontinence which is caused by several factors, so like spine related problems, brain related issue, and other central nervous system related issues which are ultimately affecting the continence mechanism. Symptoms of incontinence and why this happens. The symptoms of incontinence, as I said earlier, is like one has no or very poor control over postponing the desire to pass urine is incontinence. Like every time you feel like going for the loo and you cannot prevent that desire, and one has to get up if he is sleeping or he is busy in meeting or work or traveling. They have to get up from their place and then search for the perfect place to pass urine. Why this happens? As I said earlier, that urinary bladder has a capacity, it is a involuntary muscle. So our body mechanism is such that as and when the urine accumulates in the urinary bladder, the bladder's elasticity is good enough to expand and maintain the pressure at certain level at the resting position. When the urine is getting accumulated, the bladder pressure remains at about less than 10 centimeter of water, we say. But whenever we get a desire to pass urine, the body mechanism is such that you increase, or the signals from the brain or the spinal cord goes to the urinary bladder, and then the pressure in the urinary bladder will increase and you pass urine as per your desire. Whenever there is a disturbance either in muscular level, like in the controlling mechanism which fails to relax or relaxes because of the poor support, or the muscles of the urinary bladder, they become overactive, like they suddenly develop a high pressure which is very difficult to control, and there is a leak. So this is how the incontinence occurs. Treatment options. See, the best part of the treatment is being aware about the situation. So it is better to consult a doctor whenever you have these symptoms. So whenever in the early stage, if you realize that this is a problem with me, or like frequently you have to go to pass urine or you have to get up in the night 2 or 3 times, or you are unable to postpone the urge of urination, I think you must consult a specialist doctor. We initially ask you to modify your fluid intake, habits of passing urine. So we will tell you how exactly how much fluid should be consumed at what time, and one has to sometimes monitor by writing on a piece of paper, like we call it bladder diary, that at what time you pass urine, what time you consume fluids, or